Greetings, Tufts University School of Dental Medicine colleagues. This past week, I had a town hall for our faculty and staff that was attended by about 350 people. What I'm about to share with you is much of the information I shared at that town hall. It's intended for those of you that didn't have the time to be there or couldn't attend. And it's also intended for our students and residents who haven't been given the update. So over the past month, we've been talking about resumption of our preclinical activities, our research activities, our academic continuity and operational continuity. We also have resumed some of our in-person teaching activities with some of our residency programs. Tufts University School of Dental Medicine continues to be a beacon of hope and safety. And this is because despite the uncertain and anxious times, our faculty and staff have really offered hope and safety to our students, residents, and patients that are returning to our building. Since the last town hall that we have up to 400 people on average entering the dental school per day. Many of these faculty, staff, residents, and patients are getting screened by our wonderful front desk staff. We're also open 7 days a week to see patients. That includes our pediatric and orthodontic division that are here on the weekends, supported by the faculty, the residents, and the staff. Many of you have adopted the new practices in this new normal, which include filling out self-attestations when you come into the building, picking up scrubs, changing the way that you don and doff your PPE, et cetera, et cetera. Last weekend, with the support of our faculty and staff, we held licensing exams that included a live patient portion, as well as the odontotype piece. Many of you helped our D20 class graduate on time, and I believe almost all of them are done. And last week, we celebrated the accomplishment of all of our residents that were finishing up. Many departments had virtual celebrations. On July 1, we as a community greeted 71 new residents from all over the country and some international residents as well. So on a daily basis, people are engaged, they're busy, and I thank you all for all that you're doing for Tufts University School of Dental Medicine. We also had a shout out for our volunteer faculty. I sent them an email last week thanking them for all that they do for our school and indicating to them that with our current slow start in our clinics, even though we don't need them at this time because we have enough part-time and full-time faculty, we hope that as our clinical services ramp up, that we will greet them back here at the school sometime in the late summer or fall. I thank my alumni who have been very supportive, not only in terms of expressing how things are going at the school, but also for the financial support they've given our students in the form of financial aid. We also have had some faculty that have indicated now is a good time for them to retire. I thank them for all the years of service that they've given to the school, the compassion and love they've had for our students and patients. And I do want them to know that at some point in the future, we will have an event of special recognition for all that they've done over the years for our school. This week, I also attended a webinar by Marko Vujicic, an economist from the American Dental Association. I would encourage you to go to that website and look at the survey data that he's collecting. The encouraging news is that the dental economy continues to rebound. And as of the week of June 29th, 97% of dental offices in the US were open, and patient volume had rebounded to 70% pre-COVID-19 levels. I know many of our faculty are in private practice and are experiencing patients coming back into their practices. And even though they're still challenged, it's encouraging to see for our students and residents that are currently here, that in the coming year or two, we expect the dental profession to rebound. We expect oral health to be an important part of general health. And we expect our profession of dentistry to come out of this pandemic as being strong and for you to have strong careers when you finish your dental school here at Tufts. Few state and Mass Department of Public Health updates. I think this is important for you to recognize why we're not resuming full clinical services and taking a very stepwise approach to our care. Right now, we are in phase 1 here at the Tufts University School of Dental Medicine. We are anticipating moving to phase 2 in late July, beginning of August, and I'll share with you what that planning is. And we recognize that even though Massachusetts is in phase 3 in the city of Boston as of July 13th, that our phasing is separate from what the state guidelines are. Here is the state reopening piece. We're moving from phase 2, which is cautious, to phase 3, which is vigilant. I'll just highlight that the difference between phase 2 and phase 3 as far as clinical care goes did not change. And in fact, we're following many of the kind of preconditions that we were given in phase 2 here at the school. In other words, we continue to treat patients whose conditions, if allowed to progress, would worsen without our interventions. Second of all, we follow this guidance here, which says that we need to be very careful about procedures which are likely to produce high concentrations of respiratory droplets or aerosolization. And as you can see, as we enter phase 2, we'll still be cautious about aerosols that we generate. And we're putting into place many mitigating kinds of processes and building changes to help with aerosolization. Despite the fact that on June 24th, the state mandated that healthcare providers can start doing elective cosmetic procedures, we are holding off on this in terms of our slow phased introduction to procedures. What is also encouraging is that we can occupy our buildings up to 50% now. But again, in our clinical care facilities, we're going to be cautious about overburdening our elevator systems and our points of entry here at the school. A few university updates for you. The university also has its own way of phasing in resumption of services. Right now, we're in phase 1 at the university level for limited access. But Medford is preparing for phase 2, which is preparation for hybrid reopening. In other words, with the return of students to the Medford campus, they're preparing for in-residence and hybrid types of educational programs. In terms of resources, the university keeps developing guidelines and resources. I mentioned to you the return to campus resource. This is a resource for staff, faculty, students, and residents. I would look for this on the website. If you can't find it, let us know. But again, it's got great tips on certain things about safety, returning to work, guidelines around commuting, etc. People have asked a lot about travel and our COVID-19 policies. What I want to stress to you is there is a difference between having to self-quarantine, either if you are diagnosed as being COVID positive, or you've come in direct contact with someone who's COVID-19 positive. The other reason for self-quarantine is travel. And right now, the university has put out a general guideline that says, as long as you're practicing good behaviors, no matter where you are in the country, we will treat you as if you're in Massachusetts and could get exposed within the state. So if you're up in New Hampshire or Maine and you're wearing a mask and you're not in a large group getting exposed, or there are no other settings where you feel like you're exposed, you're welcome to come back into the building for work or for school, as long as your self-attestation says you don't have symptoms and you haven't been exposed. Similarly, if you're traveling from out of state, if you feel you're not in an area where you are unnecessarily exposed, you're welcome to come back. And we will be sharing with you more details on that. On the other hand, if you're COVID-19 positive, we feel it's your obligation to report that to the COVID-19 email site, Dr. Rosenberg or Dean Kasberg, and to do self-quarantine and then to follow the policy and procedure that would allow you to come back as well. There's also a guideline that we'll be sharing with you around being in direct contact with someone who's COVID positive. If you're a faculty or staff member, there's also guidelines on how to use time during those periods of self-quarantine, and these will be shared with you in a final version in the coming week. You've heard a lot about testing. The main campus will be testing people as they come back to that campus. Here on the Boston Health campus in the coming month or so, we're also hoping to have testing not only for our employees, faculty, residents, and students, but we also have a protocol now where we will be testing our high-risk patients. We've had 2 patients tested already here through the Tufts Medical Center. A few updates on our phasing for our reopening of our clinics and preclinical spaces, and then an update on our financial situation. As you know, we're currently in phase 1, and many people in our clinics in the graduate programs and DMD program have been exposed to what that looks like. In phase 2, we assume that we've got limited testing, again, for our patients, that we'll continue to screen people. We continue to maintain social distancing and wearing of the masks in the building. And we anticipate that we would like to get to about 50% of floor openings, but this is dependent on movement in the building and movement on our elevators. You will also be getting a new PPE protocol. As you know, in phase 1, we have made a commitment to providing the top level of PPE, but now with Dr. Papa George's help and many other clinical leaders, we will be talking to you about different tiers of care. So for example, if you're seeing a patient for an exam or removing a suture, you will be provided with one level of PPE versus doing an aerosol-based procedure. We also will talk to you about the reuse and repurposing of masks. These are policies and procedures that have been put into place by many hospitals. We'll continue to follow best practices, but in order to manage our PPE supply, we will be expecting our community to reuse or repurpose our respirators. In our preclinical phase, we continue to have students come into our clinical spaces. It's nice to see our students and faculty in those spaces. And many of our students now will be using that space to prepare for a licensing exam that will happen in mid-August. Here you see a footprint that shows the timelines for the opening up of our other floors. You'll notice that many floors are receiving HVAC upgrades. This is to make sure that we minimize spread of the virus through our central air systems. So our engineers have been working on mitigating processes for these, upgrading the filters, putting UV lights into our HVAC system, making sure that the air is circulating as needed on a cycle per hour basis. And so once these upgrades are done, we can move up into the other floor. These upgrades were already made for the 2nd, 3rd, and 4th floor. So if you look at this graphic, what you'll see in July is that we continue our work on floors 2, 3, and 4 as prescribed. But you can see that there are some floors where the HVAC upgrades have been done, and we anticipate moving some of our graduate programs up into the upper floors on a certain time scale. So the first programs that will open up are orthodontics and endodontics on the 11th floor. Oral surgery will open up on the 5th floor, followed by prosthodontics, implant dentistry, aesthetics, and perio on the 12th floor. And eventually we'll be able to open up the 8th floor to more pediatric dentistry type procedures. As that happens, the DMDs will get access to their own floors as well. This shows you a modified schedule for our DMD clinics. Our DMDs have been seeing patients that mainly require prosthodontic work in terms of delivery of prosthesis or crowns. Now you see, as we enter July 13th, that there will be different disciplines, but we will stick to low aerosol procedures. In addition to that, we continue to have our students come into our SIM clinics, our IS students and D students. And in addition to that, our students have been rotating through our emergency clinics. Phase 2 continues development of spaces. So for example, we're reviewing our protocols, schedules, staffing, but more importantly, we're putting up more plexiglass in our clinics. So in the 12th floor, for example, we now have plexiglass partitions that will allow more aerosol procedures. We're putting in our extraoral aerosol capture units in most of the chairs here at the school, and we'll continue to look at in-room, on-floor filter units as well. So again, we're looking at movement to other floors in phase 2. I mentioned the development of our physical spaces. I mentioned the protocols for new PPE tier level types of use. And we'll continue to categorize our procedures based on risk, those that are low risk, like exams or suture removals, those that are medium, that have a rubber dam, where aerosols are basically created, but we don't have an open mouth environment. And then for those high risk procedures that might be surgeries where you're doing use of a high speed or a crown prep, we hope to mandate testing for most of these patients, use an isovac or extraoral aerosol capture, and have in-room filtration. I'm not going to go through these in a lot of detail, but these are the kinds of tables that we're using to look at how we use aerosols with rubber dam and what we're doing to mitigate aerosol spread. Obviously, in an open mouth environment as well, we need to be a little bit more careful about our procedures. And then finally, you know, we're prescribing things such as using a low speed handpiece with low RPM and irrigation for when you do periosurgery. So again, you're minimizing high speed use with a big aerosol spread. And then finally, for surgery where you have to use a high speed as well, we have certain kind of rubrics that we'll end up following. And here you see an example of what was developed by Drs. Ghaffari, Ramesh, Zandona, and others that show the kind of tier of care that might be provided in our pre-doc clinics. So faculty are taking a lot of time thinking through what is appropriate for each phase and what minimizes exposure to our care providers. Hopefully we get into phase 3 if we don't have a surge in the fall, recognizing that with each step we may have to go back depending on what's happening locally. But if we're able to have good testing, daily testing, point of contact testing for patients, that would be able to increase our activities. And if social distancing were to get lifted, we can start to increase our volume of patient care here at the school. And then finally, phase 4 would include a vaccine or a treatment that would mitigate many of the things that we're doing to avoid spread of the virus. I would like to turn my attention now to the financial challenges that we have here at the school. Many in our community are concerned about our financial issues that we're facing. The students and residents obviously are concerned about the cost of education. And I will say that given the financial situation that we're facing, hopefully this information will show that we're doing everything to contain costs. We're not passing costs on to any members of our community just because we're facing a financial crisis. So here you can see that for our tuition and fees, we're recognizing about a $3.5 million loss. This is due to international students potentially not getting here because of visa types issues. The biggest area that we see a deficit is in our clinics, where we see $22 million loss. So this academic year, we're anticipating a $26 million loss. This is before putting any mitigating factors in. Some of the mitigating factors that the university has taken is there are no merit increases or cost of living increases for any faculty or staff. We've paused any additions to our workforce, and we've taken away overtime. Here we recognize about a $5.5 million saving. We also have had savings in other areas up to about $8.2 million. We will be sunsetting some of our programs for cost saving purposes. That gives us a $1.3 million saving. After all of that, in terms of what we started with, we end up with having to make up about $11 million. And this presents us with a great challenge. And we will be looking at all different types of scenarios in order to deal with this challenge. So in terms of our budget finalization timeline and steps, on July 13th, working with our chairs and deans, we will connect and look at all options. On July 15th, we'll finalize our process. And July 20th, all recommendations for any reductions, program closures, and reduced hours in terms of staffing will be sent to the university. And we will start to implement some of these changes starting August 3rd. I thank you for everything that you're doing, for recognizing the challenges that we have ahead of us. And I know that as a team and working together, we will meet all of these challenges. I'll leave you with this one reflection. Many people have come to me at the end of my first year as the dean, which was the end of June, and have felt sorry. In fact, one of them expressed to me, "I'm sorry that you were dealt this hand of cards." I would like to share with you this saying from Voltaire, in quotation marks: "Each player must accept the cards life deals him or her. But once they are in hand, he or she alone must decide how to play the cards in order to win the game." We're not necessarily here to win the game, but I can tell you that whatever cards we've been dealt, either me as a dean, my leadership team, our faculty, our staff, you as students and residents, I know that we will play those cards with the health and safety of our community in mind. We will take on these challenges as best we can, and we will persevere. Thank you for your attention.